Before the imaging begins, explain the full nature of the exam to the patient and remove any radiopaque artifacts. Ask if he has any questions and obtain a clear verbal consent before proceeding. For an AP axial foot X-ray, the X-ray tube is positioned at a standard 40-inch or 100 cm source-to-image distance. The central ray requires a 15-degree cephalic angulation directed towards the heel and is centered at the base of the third metatarsal. The patient sits on the table with the foot placed flat down the long axis of the image receptor. Use a 40-inch SID with a 15-degree cephalic angulation and center at the base of the third metatarsal. This 15-degree angulation ensures the beam is perpendicular through the metatarsal joint spaces. Open the collimation an inch on both sides to capture all digits. Place the marker and show the gonads, then make an exposure. A diagnostic anterior-posterior axial foot radiograph must demonstrate open interphalangeal, MTP, and TMT joint spaces, free of motion and rotation. For a median oblique foot X-ray, the X-ray tube remains at the standard 40-inch source-to-image distance. The central ray is perpendicular to the image receptor with no angulation and is centered at the base of the third metatarsal. For this procedure, there is no tube angulation. Instruct the patient to rotate their leg inwardly at a 30-degree angle and center at the base of the third metatarsal. A steep rotation will superimpose metatarsals, so a 30-degree angle is optimal and best to demonstrate the cuboid. Collimate to include the area of interest, shield, and make the exposure. The medial oblique must clearly show the tuberosity of the fifth metatarsal, the cuboid, and an open sinus tarsi with proper bony detail.